total of 67 deaths have taken place in western UP's Firozabad and Mathura districts due to the dengue hemorrhagic fever, which is a severe form of the dengue virus. Over the past 10 days, a majority of those cases, 52, including 40 children, were reported from Firozabad district. A 6-member team from the NCDC, or National Center for Disease Control, consisting of entomologists and experts in vector-borne diseases, was rushed to the affected areas. They will give their report today. Hospitals are full of sick children and adults, and heartbreaking scenes are being seen outside the Firozabad hospital, where a mother even fell to the feet of a doctor as her 12-year-old child was not getting admission. The doctor then helped the 12-year-old child get admitted to that hospital.
अगर हमारे यहाँ इस समय 540 बच्चे हैं, अगर एडमिट नहीं करते तो ये नौबत ना आती। और एक यहाँ सब एडमिट होना चाह रहे हैं, वो कह रहे हैं हमें एक बिस्तर पर लिटा दो 2 लोगों को, हमें कोई परेशानी नहीं है। बात भी सही है, इस समय हमारा मकसद ये नहीं देखना है कि क्या है क्या नहीं है, हमारा मकसद सिर्फ मरीज की जान बचाना है, चाहे वो जैसे भी बचे। इसलिए हमने जैसी संज्ञान में लिया, अगर अंदर आया होता तो ऐसा नहीं है, मैं वहीं कुर्सी डाल के बैठी हूँ कि किसी मरीज को तकलीफ ना हो।
ऐसा है कि अभी हमने जो सर्विलेंस टीम बनी है वो 754 है, 55 है सॉरी, और जो हमारे जो कैंप लगाए आज हमने 64 लगाए हैं, जिनमें पेशेंट आए 4469 आए हैं, जिनमें बुखार के 3044 पेशेंट आए हैं। इसमें हमने जो भी जांच की है अब तक के 394 सैंपल अब तक भेजे हैं, और जिसमें 236 KGMC से आए हैं डेंगू पॉजिटिव, जिसमें स्ट्रेप्टाइफस के 24 हैं और स्पायरो किड्स के जो लेफ्ट स्पायरो किड्स थे वो हैं हमारे 4 केस आए हैं। और जो आज की एक मृत्यु की जो रिपोर्ट है वो हमारे पास एक है। अब तक कुल मृत्यु की जो संख्या है जो बुखार से पीड़ित हुए हैं वो 52 जी। तो ये हम लगातार प्रयास कर रहे हैं कि हर जितने भी हमारे ब्लॉक हैं उसमें कम से कम 10 हेल्थ कैंप लगा रहे हैं। तो इस समय तक की पोजीशन है 430 है जो इस समय भर्ती है टोटल, जो हम PSC और CSC को तो स्ट्रेंथनिंग कर रहे हैं, और हमने आज कई जगह इसमें भर्ती करने की प्रक्रिया भी की है। और जो कल तक जो CBC का ऑटोनाइजेशन मशीन लगी है तो वहाँ पे हम CSC PSC पे वो अब भर्ती होना शुरू हो गए, और उसकी अपडेट हम लगातार कर रहे हैं।
Well, let's go across to Alok for more. And Alok, give us more details of, this disease, dengue, that's being reported in Firozabad and other districts, and the fact that it's such a desperate situation still outside hospitals, parents having to fall at the feet of a doctor to get their 12-year-old admitted.
You're right, Gargi, and that shouldn't happen, right? Because if you look at the timeline of what's happened in Firozabad, which is a western UP town, Chief Minister Adityanath visited last Monday, that is 7 days before, and he said that all infrastructure, I'm sorry, I'm going to remove this mask, it's very humid. He said that all infrastructure was being put into place so that, nobody has to wait for admission, nobody has to die, etc., etc. That was last Monday. 2 days ago, a top government official, Alok Kumar, who is the principal secretary in the government of Uttar Pradesh, visited Firozabad, and he was told to camp there. So I don't know if he's still there or not, but he was there over the weekend. And he again inspected many areas. He inspected the hospital, and he said that adequate provisions were being made to deal with the influx of patients. A separate wing was set up within the same 100-bedded hospital where more beds were brought in, more infrastructure was brought in. And yet you have this deluge of patients coming into this hospital because it is the dedicated hospital for treating these severe dengue cases. Now, yesterday, the chief medical officer, when asked by a journalist what they were doing to make similar provisions, or at least some provisions, in the rural hospitals, which are community health centers or primary healthcare centers, which are the first point of contact for many villagers who can go to those hospitals if there is infrastructure. So then he said that, yes, we are getting in additional machines, or we are getting in additional manpower, etc., to also make those CHCs and PHCs functional enough to admit these patients. Now, this is happening a fortnight after 52 patients have died in that western UP town. And the center has sent a surveillance team, and they are all saying that this is a severe form of dengue and it needs to be contained. Now, one can certainly ask the question whether the measures by the government in this case are half-baked, whether they are too little too late, or whether they should have come in earlier. In all of this, the patients are suffering because they have been told that they have to go to this 100-bedded hospital and they need to come there. The government is saying that they are also providing ambulances for people to bring their children or any persons who are displaying viral fever symptoms to this hospital. But outside the hospital, there's an absolute deluge. You know, there are patients sitting on the ground. There are patients who are sitting with children who have high fever on the ground for hours, at least an hour or 2 hours before they get admitted. Now, in this case, you did see that the principal of the medical college had to intervene, and she was informed of this case by journalists who were filming outside the hospital. But this, again, is an exception. It should not be the norm, because ideally, anyone who is coming into that hospital should be able to get enough attention for their people or their patients to actually get some attention instead of having to sit on the ground outside the hospital and wait, even if it is for 60 minutes or 90 minutes. That is too long a time when it comes to diseases like this. So one does hope that there will be more focus on helping those in need in that Western UP town and district right now.